They were always on defense, and I wanted to focus on training employers, giving employers information to get themselves up to speed and to be able to monitor their workplaces and administer their workplaces better. So now, as we've dealt with this COVID-19 crisis, we have many, many more issues that we have to deal with above and beyond what we normally do. And just as it took a lot of planning for us to transition our workplaces during shutdowns, it's going to take just as much planning to get everyone back to work. And so that's what we're here to talk about today. So there are a few major areas that we are going to focus on here, and those are listed on this slide that you're seeing. And that is, we're going to talk about workplace safety. We're going to talk about all of the leaves that have come into play. Some of them are currently in play. Some of them will be available when employees come back to work. We're going to talk about expanded unemployment compensation benefits, because that is an issue that I am dealing with daily with a lot of you right now. We will have even more of that as we recall employees back to work. We will talk about work from home policies. Work from home obviously has expanded tremendously since the COVID-19 crisis started, but we need to talk about what things employers should consider in whether or not they continue those work from home policies. We're also going to talk about selecting employees either for layoff, if you unfortunately need to do that, or recalling employees for layoff, particularly should you choose to recall fewer than all of the employees whom you previously had to lay off. And then we're going to talk about some best practices as well in terms of how managing all of these things that we're going to talk about here today. The first and most important thing to keep in mind as you return employees to work is workplace safety. And it's also important to remember that the guidelines for workplace safety are changing quite regularly. So something that we talk about today may be different a week or 2 weeks from now, but here are two very good sources for you to look at. And I would recommend strongly to you that you're familiar with these sources as you reopen your workplace or bring more employees or customers back into work. And that is the CDC website. They have a lot of recommendations for employees and workers. And then the OSHA website. That website has recommendations for safety measures that are based upon the risk levels in various types of employment. And so I've provided the links here for you. We will have this PowerPoint on the ELDI website, and I'll give you that site several times throughout today's presentation. That site is eldi.legal. We will have this PowerPoint up on the ELDI website, and you'll be able to see these links as well. But I do highly recommend that you periodically check the CDC website and the OSHA website to make sure you're up to date on that information. What are some things, though, that employers really need to consider? As you're going to see, this is a very, very long list. So there's lots of things that you need to take into account as you are planning bringing employees and maybe customers back to your work site. The first is employee health screening measures. First, you want to encourage employees to monitor and self-report any symptoms that they may have. Fever, dry cough, shortness of breath. We've seen those things on the news for a couple of months now, but those are things that employees should be reporting to you. But you as the employer have to provide very clear reporting procedures. And this is a business decision that you as an employer need to make. That is, who do you want your employees telling when they have a particular issue? Do you want them to tell their supervisor? Would you prefer that they go right to HR if you're fortunate enough to have an HR department or an HR representative? There's a lot of invasions of privacy going on right now beyond what we would have talked about if we were talking about workplace illness 3 months ago. But we still have to keep in mind that although employee privacy has been, lifted somewhat, we still have to be careful about it. And so you really want to think about whether or not you want the employee to report to a supervisor with whom they work directly, or if you'd rather them report to someone else, so that again, we can try to maintain some level of privacy. But that's a decision that you as the employer have to make and plan for. You want to ask and make it very clear to your employees that if they are experiencing symptoms of illness, they should leave the workplace for the day. And this may require you as an employer to relax some of your illness standards. Many of you have discipline policies, whether you assign points or you list occurrences when employees are sick or they leave for the day. At this juncture, we want to focus on workplace safety a bit more. And so you may want to consider relaxing some of those requirements so that employees who are experiencing symptoms will come to you, tell you they're experiencing symptoms, and then go home. Similarly, if a supervisor observes an employee who has some of the symptoms that we're talking about, the coughing, not just one or two, coughs, but a coughing spell, shortness of breath, those types of things, supervisors really should go and ask the employees if they are okay, if they are experiencing symptoms, and then consider whether an employee needs to be sent home. Now, again, this advice is a little bit different than if you had gone to this type of a seminar a year ago, 3 months ago. But that's what we need to do in this era of COVID, particularly as we're trying to keep our workplaces open right now. This is a pandemic, and due to this pandemic, some of the rules are relaxed a bit, even from the standpoint of the EEOC, the Equal Employment Opportunity Commission, and some of the state level commissions. They're giving employers a lot more leeway, and this is one of those areas. So we want to encourage employees who do have symptoms to stay home, and maybe to stay home until they can consult with a medical professional. Now, I grant you, many of you are thinking to yourself, you've got to be kidding me, Kim. It's allergy season, everything's blooming. If the standard is sneezing or coughing or anything, then I've had COVID for 10 years. I get that. But in this time frame, we need to just pay a bit more attention, and employees can be asked to leave the workplace if you feel that it's appropriate and prudent to do so. But again, it goes back to that concept of, do you want to have a point person to make decisions and make decisions consistently? So that's something that you do have to think about. Now, employee temperature checks. That is a big issue. We're hearing about it all the time on the news. I know that many of you who have been operating throughout this pandemic have been doing employee temperature checks, and it's really important to do so. I just mentioned a moment ago about relaxing some restrictions. This is a big one. The EEOC authorized the use of temperature checks in guidance that it issued back on March 18th. And the CDC has also recommended the use of temperature screenings, again, because they've acknowledged that there's a very significant community spread for this particular illness. And so the CDC and the EEOC are authorizing these types of exams when they otherwise would never, ever be permitted. So important things to keep in mind. Number one, a temperature is not always a symptom of COVID-19. It's still a permitted temperature check, or excuse me, a medical check. So you may think, well, what is the point of doing a temperature check if that's not always a symptom of COVID-19? The benefit to it, if you choose to do temperature checks, and we'll talk a little bit about that in one second, is it is a frequent symptom. And so you are very likely to catch people who may be symptomatic or who may be getting ready to become more ill by doing a temperature check. But something that you have to consider, and this is a very real consideration, and that is, what does this do to employee morale? Some of you have had employees who have been home for almost 2 months, and they are tired of this. And although we are very, very clearly trying to be careful about opening our workplaces, we have to think about what the perception is for employees. Will they consider it intrusive? Will they consider this a morale issue? Will they say, why should I go back if I'm just going to have to deal with this every day? And a lot of this is about the presentation. how you go about presenting this to your employees, that we just want to keep everyone safe and we want to keep everyone back to work once we're fortunate enough to get you back. And so this is what we're going to do. That would be a way to communicate that you're going to start doing temperature checks. So if you do decide that you're going to do temperature checks, what are some of the guidelines? What if someone says to you, no way, you are not taking my temperature? What are you going to do? Are you going to ask them to leave for the day? Are you going to say you can't come back to work until you are willing to have your temperature checked? Talk to the employee. Is there a reason that they may not want to have their temperature checked? Is there something that we can do? Can we talk this through with an employee? But understand and make a decision up front as to how you are going to handle that, because it may happen. Also, you want to keep results confidential. This is not something that should be shared. So although temperature checks are allowed, as I just said, it doesn't mean that we're publishing lists or even keeping lists of everyone's temperature every day. However, if you do have employees who have elevated temperatures, and one of the guidelines is temperatures above 100, 100.4, but you may look at some different guidance for your business and come up with something different. But if someone does have an elevated temperature, that is something of which you should keep a record. Because if that employee turns out to have symptoms, you're going to send them home. If they later turn out to have symptoms, if they end up being diagnosed as positive for COVID-19, we now have to trace who that employee was in contact with. When were they last at the workplace? Things of that nature. So that is something that we would want to keep a record of if someone has the elevated temperature. Also, I suggest if you can find one, this is part of the planning that comes into returning employees, you want to use a scanning thermometer as opposed to an oral thermometer. It's less intrusive, quick results, things of that nature, and you want to use one device so that you have consistent results. When employees are waiting in line to get scanned, should you choose to do that, you want to, as much as possible, ask them to stay 6 feet apart. And we're going to talk in a minute about staggering reporting times and things like that, which can help here. But we do want to keep employees distanced while they're standing in this line to get their temperature taken. And understand that if employees have extended waits, like if they have to wait in line for 20 minutes to get their temperature taken, that is going to be compensable time. So you want to minimize the wait time, because you don't want to pay somebody for standing in line for 20 minutes to get their temperature taken if you can in any way avoid that. And that was a lesson learned, very, very hard lesson learned by Amazon. They had not temperature checks, but they had an issue where they ended up having to pay employees time for certain security checks. So you want to be very mindful of this. And as you are planning, you want to do everything that you can to minimize wait times. Also, you want to see if you can have a way to provide employee privacy. So for example, if you can have employees waiting in line to get their temperature checked, and then maybe they turn a corner and actually get their temperature scanned, so that if they are high, they're told what to do in a private manner and not everyone knows that that particular employee had an elevated temperature. That's a piece of planning that you want to take a look at as well. You want to think about who's going to administer these temperature checks. Most of you don't have a nurse on site. So you want to pick someone to do the temperature screenings, maybe someone in HR. Sorry to all of you HR people, I continually nominate you to do things. But you want to pick a person who can be discreet. That person who themselves is administering the temperature screening should take their own temperature to make sure they don't have an elevated temperature. And you want to provide personal protective equipment for the people who are actually doing the temperature checks. At a minimum, they should have gloves, mask, depending upon what the work environment is, glasses, safety glasses, like those great looking glasses you get at the dentist, or a face shield if that's necessary. but you as the employer should provide that. So that's something that if you want to do the temperature checks, make sure that you get that equipment in before you start doing the temperature checks in the workplace. People are going to become symptomatic and we're going to bring them back to work. And so what do we do when we're bringing back symptomatic employees? We want to consider, and the most important thing to consider here is whether a doctor's note is required in all circumstances. Because all of us who are employers, we talk many, many times, and for those of you who are regular attendees of our ELDI seminars, you know I talk about doctor's notes and certifications and those types of things all the time. Here we need to try to relax a little bit and think about what different forms of proof we can get that someone is clear to work. Maybe they're just going to get a note from a nurse practitioner. Maybe just the stamp of something cleared, return to work. Maybe confirmation of the results of a telehealth appointment. Maybe if an employee is willing to give it to you, a negative test result. Any of those types of things could be okay, but you need to discuss it with the employee and see what they can get you. If an employee says to you, hey, I can't get a test, my doctor won't do anything, this is their policy, can we get a copy of the policy? What the doctor's office is doing, you know they have it posted in the doctor's office, can you get a copy of that? Talk to the employee and see what the alternatives are. And if the employee absolutely cannot get anything at all, then maybe you have to assess the risk of whether you want the employee to return or you want to keep them out for some additional time. But that's something that you'll have to really work through carefully with the employee. What about starting new employees? Because many of us are advertising for jobs, particularly for when we reopen. After you have made a conditional offer of employment to a new employee, you can do a temperature check or screen for COVID-19. That is permitted. You can delay the start date of an employee who is showing symptoms. So if you do a temperature screen, something like that, or the employee becomes symptomatic, you absolutely can delay their start date. And if you've got an employee to whom you made an offer and you need them to start right away, but they are sick or they are symptomatic, you can withdraw their job offer because you need them to start right away, but they cannot enter the building safely. So that is a basis for you to withdraw a job offer. So that is something that's very, very important to keep in mind as well. If there is an exposure in your workplace, you must have an exposure response plan. Am I saying that you have to have a very detailed document? No, I am not, but you have got to have a plan in place. If you are going to reopen, you have to understand and anticipate that someone will be exposed because of how contagious this is. So think about these things. What are your stay-at-home requirements going to be? How long are you going to require an employee to stay at home and under what circumstances? Let's say somebody has a fever one day, but then they've been home for a couple of days, they're not taking Tylenol, they're symptom-free for a couple of days, 48 hours, and they have no other symptoms. Will you return them to work? Have they been using personal protective equipment in the office the entire time they've been working? Have they been distanced from other people? What are the risks? So what are we going to make our stay-at-home requirements? What circumstances are we going to force an employee to stay at home? And understand that if we have somebody stay at home, you're going to have to be prepared to answer questions about what does an employee do for pay or leave, things of that nature. We're going to talk a lot about employee leaves in just a minute. You want to think about contact tracing. It's a very scary term that a lot of us don't really like for privacy reasons, but as an employer, you have to be able to say, gosh, who was this employee near for an extended period of time? Not just, who may they have seen or not, but who would they have had some kind of prolonged exposure to? Right now, the guidance tends to be that they're within 6 feet of a person for 10 minutes or longer. But again, that guidance is changing all the time. But think about how you would contact trace in the event of an exposure. And then think about who is going to communicate to employees in the event of an exposure? So let's say you have an employee on third shift in such and such a department who has been exposed. Who is going to be the employee to tell the other employees on third shift that there has been a possible exposure on their shift in their department? And what is the wording of that going to be? You're not going to disclose employee names because, as I said, although some privacy considerations have been loosened, we are not in a position where you're going to disclose a particular employee name. So think about what those communications are going to be and who is going to give them. And then if an employee is tested who was exposed, be prepared. If they did not test positive for the virus, who is going to communicate that? If they did test positive for the virus, who is going to communicate that? And what will be the consequences? Does everyone go home in third shift? What do you do? So just be prepared, and that's your exposure response plan. When you bring employees back to work, you are going to have to provide personal protective equipment for your employees. So you probably want to start ordering it now if you haven't done that already. You want to have masks, you want to have gloves, you want to have face shields depending upon proximity to people. Like I said, you can also consider those great looking glasses that you get when you go to the dentist as well. Again, depends on the level of risk in the job. And for that, I refer you back to our first slide with the guidance on those OSHA regulations. They're very, very important as well. Make sure you're stocked up on soap, hand sanitizer, disinfecting wipes, have all of those things readily available to your employees. And make sure that you detail what your cleaning procedures are going to be. Number one, it's critical to stopping the spread of any potential exposure in your business. But number two, don't forget how important understanding the cleaning plan is to your other employees. They want to know if they're going to be safe at work. So the more that you can tell your employees about the steps that you're taking to clean, to disinfect, you're going to have hand sanitizer for them, that makes them feel better and more comfortable about returning to work. Consider having additional workplace cleanings during the day in all the common areas, certainly. Printers, microwaves if you have them, restrooms, switches. Those are the things that are most frequently touched in any given workplace. And so a big part of workplace safety is making sure that those areas have been wiped down and cleaned throughout the day. Physical distancing, we hear about that all the time, but think about it as you're returning your employees to work. How would you ever accomplish physical distancing? So here are a few things to think about. Number one, staggering shifts. If you have a company or a business where everybody works 9 to 5, can we divvy that up? Can we have some people start earlier, leave earlier, and effectively turn ourselves into a 2-shift or more workplace? Can some people just work in the mornings and go home and work in the afternoon, and vice versa? Alternating work schedules, keeping people at reduced hours, even if they can't work from home or you don't want them to continue to work from home. Can we put them on a different work schedule whereby some weeks they're working Monday, Wednesday, Friday, some weeks Tuesday, Thursday, their hours are reduced. Maybe they get unemployment for that. We'll talk about that as well. But that's alternating our work schedules, and it's keeping the workplace less crowded, and that's important for physical distancing. Consider, even if you bring everybody back, could you stagger a lunch schedule? Not to take all of us back to high school, but maybe we want to say this half of the office is going to go to lunch at this time. Things of that nature. If you are an employer who gives breaks to employees, stagger the breaks so that not everybody is in the break room at the same time. If you have the ability to, spread out workspaces. If you're in an office and not every work area cubicle is being used, spread out your employees. Give them a little bit more space. You may want to consider asking employees who can still do so to continue to work from home or limit their time in the office. That's a very easy way to create distancing because you just flat out don't have as many people in the workplace. If you have a retail and industrial space, things of that nature, you may want to consider adjusting traffic patterns in the workplace. Do you have one-way traffic? Do you have one door that's just for entering, one door that's just for exiting? Those are things that help to just separate people without, talking about or having the little dots on the floor about we're keeping everybody 6 feet apart. So those are some things for you to consider in terms of physical distancing. And business travel. I've had so many people call me and ask me, what are they supposed to do about business travel, particularly employers that have a very large or significant sales force that travels all over the place. So think about visits to customer sites. Can you limit them? If your employees are going to travel to customer sites, make sure that they have personal protective equipment. Make sure that they have that for being on a plane or something like that, or entering a customer's work site. What can we do about distancing while people are on customer visits? Can you spread out monthly sales calls? Maybe that is a requirement that you have for your workforce, but maybe your salespeople could go to quarterly visits or things like that for right now. Can those visits be done effectively by Zoom or WebEx or something like that? And most importantly, it's a joint decision with your customer. Customers may not want salespeople coming in for sales calls. And so engaging in that dialogue shows your customer, obviously, that you're thinking about it, taking it seriously, etc. Start only with essential travel. If you have an employee who is required to travel to a particular site, maybe to get a certification, maybe to work on a new program or piece of equipment and they have to travel, that's fine. But maybe right now we're not sending them to, a seminar that's miles away, things of that nature. And if an employee asks, consider alternate means of travel that are reasonable. So for example, if normally you have an employee making a sales call, let's say in New York City, and you ask them to take the train to get into New York because it's cheaper, it's easier, it's less expensive than paying for the travel plus the parking, even if they can find it. Consider if the employee asks you and they say, they would feel better driving. Consider allowing that. It may take longer, it may be more expensive, but that employee may consider it to be safer than taking a train, a subway, or a plane. So just keep that in mind and consider it because employees may be asking you for that. So think about that as you're talking to your employees about sales calls and things of that nature. When you do start to bring visitors back into your workplace, think about what the customer and visitor protocols are going to be. Are you going to ask customers to wear masks? If so, consider having masks available for them. Understand that some people are not going to want to do that, but think about what your policy is going to be. Some of you are going to be mandated by law to require people to wear masks, etc. We don't 100% know what that's going to look like yet, but consider that if you're going to have people come to your business and you don't want to turn people away, maybe you need to have a supply of masks on hand. Do you need to direct customer traffic patterns? Maybe you want people, as I said a minute ago, to enter one way and exit another. Are you going to limit your number of customers? If you have a showroom and you were previously open to the public, probably you're going to want to go to an appointment basis for some period of time. You want to talk to your employees about how they're going to greet your customers. If you are in a service business like we are as a law firm, are you going to have your employees shake hands with other people? What is your employee going to be comfortable with? You probably want to instruct your employees to maintain a little bit larger distance than they would have in the past from your clients. And you might want to consider limiting the number of people that will attend meetings and things of that nature. You might want to offer telephone and video conferencing where that's available to you. And you want to, if you've got a business where you're selling products and things of that, offer contactless delivery and pickup. That's another way to make your customers feel safer. But understand that as we are talking about all of these different things, there is a flip side to that. And that is how you present all of this to your customers and to your employees as well, because presentation is everything. And you want your employees and your customers to feel welcome. So although you are taking all of these safety protocols, and you should, think about how you're going to present them, as opposed to having a bunch of very draconian looking signs at your doors. Will you have someone greet people and say, we're so happy to have you here today. Here's what we're doing to keep you safe. Just a different way to think about it. But it's really important to consider, because what we don't want is to put off our customers and make them feel like they're not welcome in our business. Do we have any questions about any of that I've just discussed?
Yes, we do have a couple questions. Let me start to read them.
Okay.
First question. I work in an office with little to no interaction with the general public. Can we require wearing masks in the office?
A lot of that is going to depend upon what the specific guidelines are at the time that the office is reopened. You certainly can require masks to be worn. That's okay. The issue is going to be whether you are going to have the choice taken away from you by the state. I think that if you work in a small office with very few people and you can keep them distanced and there's very limited interaction with the public, you probably should have masks available, certainly, but you might be able to lighten up a little bit on when the masks are required. But a lot of it is going to depend upon your comfort level as an employer and how your employees feel. So if you got a small office and your employees don't really face the public a lot and they want masks, there's probably no harm in doing it. But if you're a small office, people aren't on top of each other, limited exposure to the public, it really might not be as necessary. So those are some things to take into consideration unless you are mandated by the state as a condition of reopening. So for example, when hair salons are allowed to be reopened, there will be no options. Food stores, they have no options. Restaurants, servers are probably not going to have any options, things like that. You said we had another question?
Yeah, we have a couple more. Okay. What are your thoughts on temperature apps?
Temperature apps?
Yes.
I think that the difficulty with an app is consistency. So to me, what is most important about doing temperature screenings, if you choose to do so, is consistency. And so if by temperature apps, you mean an app that somebody may have and they can show you what their temperature was, I'm not so sure I would rely on that. I think that the best way to do a temperature screen, if you are going to do it, is to have everyone subjected to the same screening process so that you can show consistency. Understand that the backside of everything that we are talking about here are these lurking discrimination claims that nobody's talking about right now, except us. You're all going to be ahead of the curve. But understand that consistency in the application of some of these things is going to be very, very critical. And I think that temperature screening is one of them.
Okay. How do we determine if an employee is in a vulnerable group? Issues like heart condition, diabetes, who are immunocompromised, etc. Or can this information only be disclosed voluntarily, and can there be separate rules to allow them to work from home?
Okay, so despite everything I just said to you about the EEOC allowing tests to be, or temperatures to be taken, and they're doing that because of this pandemic, what they are not allowing is for you to go around to your employees and say, hey gosh, do you have any risk factors? Please let us know. That is not allowed. So it's a fantastic question, because you as the employer are handicapped to some extent, because some of you may say, hey, look, if I've got somebody who has adult type 2 diabetes, I really would prefer that they stay home for now. We cannot walk around the workplace and say, you know what, do you have type 2 diabetes? That is a recipe for disaster. So unfortunately, we are in the position where an employee would need to self-identify and say, look, I have risk factors. I have lung issues. I have asthma. I have, this particular condition, and I'm very concerned about being in the workplace, and then talk it through with them. That takes us back to our normal disability accommodation type conversation that we would typically have. What is that employee's exposure going to be? Can that employee work from home? Should we have them work from home? Or should we say, you know what, we appreciate that you've told us this. We understand the risk. We prefer that you stay home for now. And if we say that to an employee, how are we going to handle it? Allow them to take paid time off that may be available to them, and then allow them maybe to collect unemployment, which again, we'll talk about all of that in a minute, but we can't ask people. We have to allow them to self-identify, for better or for worse. That's how we're going to have to handle it. Do we have any other questions at this point?
We do. We have a couple more.
Okay.
Is it okay to ask an employee for their permission to use their name as a person who got exposed for communication to others?
No. There's really, I guess I'll correct that a little bit. Could you ask the employee if it's okay? You could. That employee is very likely going to tell you no. And I would be concerned, and why my instant reaction is no, that if there are any problems, anything that makes that employee uncomfortable, if they tell you no and then they later have concerns about the workplace, you are buying yourself a HIPAA claim. And so to me, I can't think necessarily of a reason why we would need to disclose the employee name. I have dealt with this issue with multiple clients in the past 7 weeks, whatever we're into this now. And I've had various reasons why there has been this discussion about should we disclose employee names. I will tell you, in every single one of those situations, we have worked around it somehow, and for good reason. Because although there are some limited privacy, restrictions that are loosening up, as I've mentioned a couple of times now, giving the name is pretty much where we cross the line, and I do not recommend it. There are ways to identify employees anonymously. Again, it's an employee on 3rd shift in this department. It's employee number 1. It's an employee in XYZ office had, potential exposure, and come up with an identifier for them. But really, I would really struggle to think of a situation where you must give the specific name. And again, I've been pressed for this for a couple of clients, and we have gotten out of it every time because there's such a huge downside to that. So I would recommend very, very highly against doing that.
Okay. We have a couple similar questions about masks. One person works in a consulting firm. Should we provide masks? They've heard that they would be liable if supplied and someone became sick. And then to the point about masks, are fabric masks acceptable that so many people are wearing in their community, and N95 masks? And
okay, so in terms of providing masks and being liable for doing so, states are actually working on laws, regulations, orders. There was one discussed yesterday in Pennsylvania, limiting liability for employers for providing masks. Understand too that workers' comp could kick in here. So let's say you provide a mask, and let's say the employee then claims that they got sick at work. That is a claim, if it can be proven that they were exposed and got sick at work, that would fall under workers' comp, and there's no outside liability for an employer for doing that. Do you need to have surgical level masks? No, you do not, depending upon the type of business that you have. And I refer you back again to the OSHA regulations on that. So for a general office, somebody asked about a consulting firm, just a cloth face covering is sufficient. If an employee wants to bring their own because they don't like what you're providing as an employer, take a look at it. If it seems sufficient, let's not make a big deal out of it. But do bear in mind that there are some industries, many of which are open right now, that do require a more protective face covering, like the N95 mask, and that's in those OSHA regulations. So I do recommend that to you for your reading. So let's hop through then to are issues about employee hygiene protocols. That's something that's really important for us to think about as well when we are focusing on our workplace safety plan. You want to consider, are you going to have regular breaks for your employees to wash their hands? How are you going to ask employees, or are you, to wipe down copiers and things like that after every use? Make sure you're going to have wipes available for them to do that. Are you going to provide tissues, hand sanitizer, things like that at every workstation? And posters, things that remind employees about good hygiene, washing their hands, coughing into their sleeve, their elbow, not coming to work when they're ill. Those are all things that we want to think about. And this is a killer to a lot of us, particularly in our office, because we get great stuff here, but no shared food in the workplace for right now. Unfortunately, the monthly birthday cake, somebody bakes a really great cake because they've been home, we're going to have to limit that one for right now. So I say that with a very heavy heart, but something that we really need to think about. Let's flip to leaves that are available for our employees. So some of these things, if you have done other seminars with me during this pandemic, you may have seen some of these, but I've actually had a couple of clients say to me, gosh, are these leaves still around once I reopen? And they are. So I want to go back over quickly some of these leaves that are available for our employees. The first one is the Emergency Family and Medical Leave Expansion Act. And we call that Emergency FMLA. This is a federal statute. This was enacted back on March 18th. And although it's phrased in terms of being FMLA, this emergency FMLA covers employers who have less than 500 employees. So those of you who are used to dealing with or taking a sigh of relief because you're not dealing with FMLA, remember the original FMLA applies if you have 50 or more employees and in a 75-mile radius. This emergency FMLA twists that concept almost completely around. So this applies if you have less than 500 employees. Now, if you do have less than 50 employees and you can make out a case that you would have to shut down your business to give these leaves, this leave that we're going to talk about, then you can try to get an exemption. But you basically have to show that you could not continue to operate, or maybe the employee who wants this leave would be the end of your business, that type of thing. Very difficult burden to meet. So for the purpose of this discussion, this applies if you have 500 or less employees. And it covers anyone who's been employed for 30 days or more. So a very shortened eligibility requirement as opposed to what you see with traditional FMLA. If an employee was laid off and then they were rehired, if they worked for 30 days out of the last 60 before they were laid off and then you rehired them, they become immediately eligible. They basically get credit for that prior service to you as the employer. This is a leave that is in place only until the end of the year. This automatically goes away December 31st, but until then, we have to deal with it. But it's limited. It's very important to understand that this emergency FMLA is only for employees who need to stay home to take care of a minor child whose school is closed, daycare is closed, or their child care provider is not available for something related to the coronavirus outbreak. Understand also that the minor child requirement has been defined in guidance to include those who have a child over the age of 18, so not a minor, but who is incapable of self-care because of some sort of a disability. And that has been added through the guidance to be consistent with the rest of the FMLA. So if you have someone who falls into this category, and many of you will because every child is home everywhere, here's what happens. There's a paid leave entitlement, but the first 10 days of this leave are not paid. And an employee can use available paid time off to them to cover this, or we're going to see in a minute that this 10 days coordinates with the new federal paid sick leave. We'll get there in 1 second, but for the purposes of the emergency FMLA itself, the first 10 days are unpaid unless an employee uses some other form of paid leave. The pay rate that they get is 2/3 of the regular rate of pay, up to $200 per day, and $10,000 total for this whole block of leave entitlement that we're talking about. So they do not get their regular rate of pay, they get 2/3 up to a maximum of $200 per day. And the number of hours that they get paid are based upon what they normally would be working for you. If they are a 40-hour-a-week employee, that's what their leave entitlement is based on. If they're a part-time employee and they work 20 hours per week, that's what their leave entitlement is based upon. Very critical to understand, this is the only paid leave entitlement in the FMLA. The rest of the FMLA is not affected by this. So it is just this one piece for a very, very limited purpose. That's very important to keep in mind. The duration of the leave is up to 12 weeks. So remember, we've got the first 2 weeks, 10 days that are unpaid, and then an additional 10 weeks thereafter. Very important things to keep in mind about this, and I cannot stress these enough. First, this leave entitlement that we are talking about coordinates with the existing FMLA. So if you are an FMLA employer, and this employee who now comes to you for this emergency FMLA has already taken some FMLA in the past year, let's say they had surgery, and they were out for 6 weeks for that surgery. That 6 weeks of surgery leave that they took comes out of their total 12 weeks of emergency FMLA. So they only have 6 weeks left. And it works the other way too. So let's say somebody takes 10 weeks right now for emergency FMLA, and in 3 months, they need to take regular, traditional FMLA because they're going to have surgery. They only have 2 weeks left because they took 10 here. So that's what I mean by this coordinates with the leave entitlement in the FMLA. Okay, very important to bear in mind. And the big question I get asked all the time is intermittent leave. And yes, intermittent leave for this emergency FMLA is available, but the employer must agree to it. So if you have somebody who can work part-time for you, intermittently, spend a few hours at home doing work for you, and then they take a couple of hours off because they need to monitor their child's schoolwork, this leave can be taken intermittently that way. So the employee would get paid their regular rate of pay for the time that they're actually working for you. And then the leave time that they take to work with their child on schoolwork is paid at that rate that we talked about, 2/3 of the regular rate of pay, up to $200 per day. The emergency FMLA has a job restoration component to it. So at the end of the leave time, the employee is entitled to be restored to their position. So let's say somebody's just going to take 12 weeks off because school's closed till the end of the year, summer camp is maybe not starting, those types of things, and they just want to stay home. They're entitled to, at the end of that 12 weeks or whatever that leave ends up being, they are entitled to be restored to their job or an equivalent position like we talk about with traditional FMLA. If the employee would have been laid off anyway, so let's say they're in the middle of their emergency FMLA leave and you have to lay off that entire department, then the employee is entitled to finish their leave. They get to take the end of that 12 weeks, and then they are laid off. But it is the burden of the employer to prove that the employee would have been laid off anyway. So again, you're looking for a clear case, like a department's laid off, or we unfortunately have to close, things of that nature, but the employee is entitled to finish that leave first before they are then laid off. This leave became effective April 1st, and as I mentioned a minute ago, this leave is with us through the end of the year, and then it is gone. Okay. The next piece that coordinates with the emergency FMLA, at least in part, is the Emergency Paid Sick Leave Act. This was also enacted in the what we call the Family First Coronavirus Response Act in the middle of March. And there are the main component here is that there are 6 bases for an employee to take leave. And an employer must provide paid sick leave, and we'll talk about the amount in a second, If the employee is unable to work or telework for any one of these 6 reasons, and I emphasize work or telework for the following reason. What are the basis for this leave? Reason number 1, as you see on this slide here, is that the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. Now, probably everybody here joining us today, and there are many of you, are subject to such an order. However, the stay-at-home orders issued by the governors in the various states qualify for this reason and would enable an employee to take paid sick leave only if the employee cannot work by coming to your business or telework. So if you're an essential business and you're open, okay. Just the mere fact that there's a stay-at-home order does not entitle your employees to this particular leave. Or even if you're a, quote, non-essential business, but there's telework available for an employee, that stay-at-home order also does not qualify to meet this reason number 1. So very important to keep in mind that it's work or telework. The second reason that an employee can take this paid sick leave is that they've been advised by a healthcare provider that they need to self-quarantine or isolate. Maybe they've tested positive. Maybe, they do have a very significant, what they call comorbidity, such as diabetes, things of that nature, and they're told that they need to stay home. They qualify for this leave under reason number 2. Reason number 3 is if the employee is experiencing symptoms of the coronavirus and they're seeking a medical diagnosis. And that second part's really important. I had a client call me one day this week, they're all running together, but it was this week, where an employee had those symptoms. But when we asked them, he said he was not going to get a test. And we said, well, you really should do that, at least get a telehealth appointment, and he refused. And so guess what? He was denied this leave. So the employee has to be experiencing symptoms and they have to be seeking a medical diagnosis in order for this leave to apply. Reason number 4 is that the employee is required to quarantine or taking care of someone required to quarantine under reasons number 1 or 2 above. And the 5th reason is that an employee has to stay home because their child's school, daycare is closed, or their child care provider can't come to work because of something related to COVID-19. So that is coordinating with the emergency FMLA that we just talked about a minute ago. That same employee who could be applying for emergency FMLA would be entitled to this paid sick leave that we're going to talk about. And there's a catch-all kind of 6th reason, and that is if the Department of Health and Human Services says, hey, there's some other reason that we think could apply here, they have the ability to add on. We don't have one of those yet. But those are the 6 reasons that an employee can take this paid sick leave. How much leave do they get? Full-time employees get 80 hours of paid sick leave. And it's very important to understand that this is new time. So any previous paid time off that you've given for sick leave, maybe you're in a state that has a paid sick leave law, those types of things, you cannot count any of that prior paid time off. This is a new federal mandated paid sick leave of 80 hours. So very important to keep in mind. You can't get credit for leave you've given in the past. It's a new 80 hours. If someone is part-time, you look at the average number of hours that they typically work over a 2-week period. So again, an employee who is scheduled to work 20 hours per week is going to be entitled to 40 hours of this paid sick leave because that's what they would typically work in a 2-week period. Carryover of this time is not permitted. This leave ends the end of the year. This time cannot be carried over. Very important. And we are back to intermittent leave on this one. Those of you whom I talk to all the time about intermittent leave, we hate it when we deal with it under the Family Medical Leave Act. It is here. However, just like I mentioned about the emergency family medical leave a few minutes ago, this intermittent leave is available only if the employer agrees to it. And if the employee can work from home, if they can telework, great. It's probably easy for you to allow it to be intermittent because somebody can work for you a few hours a day and then take leave because they're not feeling well, they need to take a nap, whatever the reason happens to be. If your employee cannot telework and if they have to report to a work site, Intermittent leave is only available for reason number 5 above, and that is the reason related to the need to stay home with a school-aged child. And there's a good reason for that. All of the other reasons for this leave relate to somebody being sick or somebody being exposed to or taking care of someone who is sick. So if telework is not available for an employee, they can only use this paid sick leave intermittently if they need the leave because they're staying home with a child who is at school. The entitlement to use this paid sick leave is immediate upon hire. So unlike what we talked about with regard to the emergency FMLA, where there was that 30-day eligibility requirement, that does not exist for this paid sick leave. And employers cannot require employees to use other forms of leave before they use this paid sick leave. Employees can choose to use other forms of paid leave first. So for example, an employee who is taking leave because they're staying home with a child, they may want PTO first. They may say, look, I want my full pay, my PTO days before I do anything else. And that's okay if it's the employee's choice. It can't be something mandated by the employer. Now, very important to remember that employers can require notice if we're going to have somebody out and they know that they're going to be out. So for example, if they're now going to have to take care of somebody, there may be alternating with another family member, caring for someone who's been exposed or who is sick. You can require that the employee give you as much notice as they have for that, just like we do with foreseeable FMLA leave. So that's kind of the same. Very important new requirement is a little bit of a change up, and that is employee certifications. So when this law was first passed, we talked about just, employees taking this leave, etc. But for those of you who were with us when we did prior webinars, remember that this leave is funded by a tax credit to the employer. And like all things tax and IRS related, we have to have 50 million documents that you never thought you could ever have in your lifetime to send to the IRS to actually prove that you properly took the tax credit. And that's where the employee certification comes in. So the Department of Labor and the IRS are requiring certifications to be submitted by employers when they give this paid leave. And the employer is going to say, hey, I'm taking a tax credit against taxes, payroll taxes I would otherwise submit. And here are the certifications for the employees who took this leave. Now, I have created an employee certification form that encapsulates these reasons for paid sick leave and emergency FMLA. And you can get this form on the ELDI website. And again, that is ELD as in dog, I.legal. And when you go on to the ELDI website, you will see there is an employer's toolkit tab. Go into that section and you will see the COVID-19 employee certification form. You're free to print it, download it, use it for yourself if you like, incorporate it into a form that you're using, but it goes through the steps of why an employee is taking leave and has the employee signed and certified to you that they actually need to take this leave. And it does comply with IRS regulations on particularly the school needing to stay home for school certification reason. Very important. You'll see things on there about if you need to stay home to take care of a child 14 or over during daylight hours, you have to give a special circumstance for needing to do so. That is not Kim on the law. That is IRS guidance. I don't think I've gone crazy. It's actually somewhere. So you will need it. Now, in addition to the certification form, you need employees to give you something else. So taking our school example, something that shows that the school is actually closed. Now, we all know that every school in New York, New Jersey, Pennsylvania, they're all closed. We get it. But the IRS is not going to keep track. So what we need is the employee to give us maybe an email from the school principal, a screenshot of the website for the school, something. And the reason for this, and you should tell employees this, The reason for this is that not that we're questioning them, but that we have to submit it to get the leave funded. And if we can't get the leave funded, they can't take the leave. So whether it's a doctor's note, something from a school principal, confirmation of an appointment with telehealth if someone's been sick, a copy of a quarantine order, whatever it is, we need it. And again, not because we're questioning people, we need it because we have to prove that we properly granted the leave for the tax credit purposes, okay? And again, I recommend that you take a look at the form and incorporate that into what your practices are. This again, this paid sick leave, like we talked about with the emergency FMLA, covers employers who have 500 or fewer employees. So that's who's covered. The rate of pay for this depends upon the reason for leave. So if somebody's taking leave for reasons 1 through 3 on the slides we looked at a minute ago, which relate to you're sick, you're subject to a quarantine order, or you've got symptoms and you're seeking a medical diagnosis, those reasons, you get your regular rate of pay for your normally scheduled amount of hours up to a maximum of $511 per day, or $5,110 total over the 10 days of leave, the 80 hours that we're talking about here. If you are taking leave for reasons 4 through 6 on those slides that we talked about, which are you're taking care of somebody who's sick or quarantined, or your kids are home from school because school is closed, those employees are paid at 2/3 of their rate of pay, up to $200 per day, and $2,000 total over this 80 hours of paid sick leave that we're talking about. And so when I mentioned earlier about the first 10 days of emergency FMLA being unpaid, and we talked about how an employee can use this paid sick leave unless they choose to use PTO. This is an instance where maybe an employee would want to use their existing PTO because it's full pay, as opposed to this paid sick leave and emergency FMLA, which are 2/3 of the regular rate of pay and capped at $200. So that's something to keep in mind. But again, it's the employee's choice. So in terms of number of hours of leave, again, we talked about it, it's 80 hours, or if an employee is part-time and their hours vary, they don't have like a set schedule of 20 hours per week, as I mentioned earlier. If you look at the average of what an employee has worked over the last 6 months, if they are a newer employee to you and you can't calculate that 6-month average, then you would look at what the expectation was when the employee started working for you. A couple of key things that are very important to remember about the Paid Sick Leave Act. The entitlement ends December 31st. It is what we call sunsetted out of the statute. There is no carryover of the time this leave entitlement ends. The Department of Labor has issued a poster advising employees of their rights under this Paid Sick Leave Act. You do need to post it in your workplace, and you need to send it to employees who are working from home or they're out on leave, things of that nature. The poster itself, if you do not have it, is also on the ELDI website, eldi.legal. You go in again to that employer's toolkit section and you will see the poster there. You can just print it, use it as many times, obviously, as you would like. If you have a significant portion of employees who are Spanish speaking, that poster is also available in Spanish on the Department of Labor website, and I certainly would recommend to you that you print it and put it up also in Spanish so that people can understand it. Employers cannot retaliate against employees for taking their leave time under the Paid Sick Leave Act. So remember I said a little bit ago about we've got to keep in mind the discrimination aspect will not go away here. This is part of it. New Jersey has also amended its law against discrimination to specifically state that you cannot discriminate against employees for taking these types of leaves. If you do not provide this leave when an employee is otherwise entitled to it, it is considered a failure to pay wages under the Fair Labor Standards Act. And anyone who's ever dealt with a wage and hour audit knows how absolutely heinous that is. So that is a very, very big stick to make sure that employees actually get these leaves. And finally, if employees do get greater benefits some other way, if they get greater benefits because of whatever your paid time off plan is, or maybe they're part of a collective bargaining agreement. Employees are entitled to get those greater leave entitlements. If you are an employer who is part of a multi-employer collective bargaining agreement, and there is a fund that you can pay into and employees can draw directly from that fund, you can do so rather than doing these individual leaves. So that's something to check out if you are subject to any of that. Some other leaves outside of what we just talked about are the new federal leaves that came into play in March, effective April 1st. But there are other leaves that may be available to employees that I just want to mention briefly to you that you're going to want to think about as employees come to you and tell you that they need to be out of work. First, use of paid time off, always available. If it's accrued, employees can take that. Paid sick leave laws. New Jersey, Philadelphia, New York City, they all have paid sick leave laws that can be used for an employee to care for themselves or to care for a family member. And they're accrued at different rates, but once they're accrued, employees certainly can take time off for that. New Jersey also has a short-term disability law, and those are for non-workers' compensation type injuries or illnesses. So that may be something that's applicable. New York State, I know we've got a number of people joining us today from New York State. They passed a coronavirus paid sick leave law also, and that's administered through their paid family leave program. But that, depending upon the number of employees that an employer has, also covers public employers. But depending upon how many employees you have and how much revenue you generate, those employers have to give anywhere from 5 to 14 days paid sick leave under the New York, and it's a COVID specific paid sick leave. So those are things that are important. New Jersey also has paid family leave, so as does New York. So those are lots of other statutes that may come into play here, in addition to those two big ones that we talked about with regard to the federal leaves that have just come into play. Now there's also unpaid leaves that we need to think about as well. So the Family and Medical Leave Act, I mentioned it before in distinguishing it from the new emergency FMLA, but for those of you who are what I'll call traditional FMLA employers, meaning that you have 50 or more employees in a 75-mile radius, an employee may be entitled to take FMLA if they themselves are sick, or they're required to stay home and take care of someone who is sick. Just remember that in addition to determining whether you, the employer, are eligible or covered, the employee also has to be eligible. So here, unlike what I talked about earlier with the 30 days for eligibility for traditional FMLA, an employee has to be with you for a year and have worked 1,250 hours or more in the past 12 months. So important to keep in mind. New Jersey Family Leave Act, it's available only to care for an ill family member. Doesn't cover an employee taking care of themselves if they are ill, but that applies to any employer who has 30 or more employees anywhere in the United States. And make note of that number of employees, because those of you who are used to dealing with FMLA, quick reminder, New Jersey changed its FMLA requirements in June of 2019. So they're now down to 30 people. That's a big change for us. But there is still the eligibility requirement for employees. They have to have been with you for a year and worked over 1,000 hours in the past 12 months. But that may be something. And finally, don't forget about unpaid leaves of absence policies that you might have in a handbook. So many of you have that. You put it in kind of as a catch-all because you know that there are things that come up for your employees. Think about that and don't forget it, because if an employee comes to you and they say, hey, I need a leave of absence, I need another 30 days, just can't handle it. Maybe they already took their 12 weeks of emergency FMLA, but you know, they're delaying the start of school, God help us all, but maybe they do. Don't forget about unpaid leaves of absences because they could come into play here as well. Do we have any questions about any of that with regard to leaves?
Yeah, we have a couple questions. Let's see. Is the certification required only for the emergency FMLA or for the paid sick leave as well?
It's for both, and the certification form that I mentioned that's on the ELDI website in the employer's toolkit covers both. So you could use one form for somebody who needs emergency FMLA, and they're going to use their paid sick leave to cover that first 80 hours. So you need it for both, and the form can handle both things.
Okay. If a business has been approved for the small business PPP loan, can they still get the payroll tax credit for the paid sick leave?
So the answer is no, you can't double dip, but you've got to talk to your accountant about that. So in an effort to everybody stay in their lanes, I defer to accountants on how they're going to best advise you to do that, but you can't get the tax credit and get loan forgiveness on the PPP end. So you do need to discuss that with your accountant.
Okay. And what about a two-worker home where both need to work? How does each workplace handle that situation?
So if everybody's entitled to this leave. So unlike the FMLA that we're used to dealing with, where you've got employees who are employed by the same employer and we coordinate leaves that way, this does not work. But that's a great question with regard to one very important aspect, and that is the emergency FMLA aspect. So when you've got two parents or caregivers home, doesn't have to be parents, it could be one parent and a grandparent, whatever it is, on the certification form that I just mentioned, and this is a requirement in the guidance, you have to certify, if you're taking emergency FMLA, that there is no capable caregiver available at the time that you are taking leave. So therefore, let's say you've got a parent and a grandparent in a home, and that employee is asking to take time off during the day for emergency FMLA, but the grandparent is home. It is a valid question, and the employee has to certify that there is no one else capable of providing care at that time. And so very important to bear in mind, if you've got two spouses who are at home, they can alternate the time being taken for the emergency FMLA to handle schoolwork and things of that nature. You have to certify and have the employee certify that there is no one else available at the time that the leave is requested. So that coordination is very, very important. Do we have any other questions on this?
We can move forward.
Okay. So let's talk about a biggie, unemployment. I am now getting more questions about unemployment and how unemployment is going to work as businesses reopen than almost anything else. And if any of you saw before we got onto our webinar today, another 3.1 million first-time jobless claims were filed. So unemployment is just simply a huge issue. And unemployment has been expanded in two very, very important ways. And the first one is what we see here on this slide. And that is the changes to unemployment that came to us through the Family First Coronavirus Response Act. And what that did was the federal government said in that act, hey, states, we're going to help supplement your unemployment trust funds. And we're going to do that if you do a couple of things. First, the state has to have had an over 10% increase in unemployment claims over the same time last year. I think that's a given, unfortunately, with the numbers that I just gave to you. Second, the state has to relax its eligibility requirements for unemployment in two very, very important ways. Number one, traditionally there is what we call a waiting week for unemployment. So when someone loses their job, the first 7 days of unemployment are considered their waiting week, and they are not compensable through unemployment compensation benefits. To get the federal relief that's talked about in this act, states have to waive that waiting week requirement, and Pennsylvania, New Jersey, and New York have all done that. Third, the state has to eliminate or modify what's called the work search requirements. And that means in a typical situation when an employee is on unemployment, they have to certify weekly that they've been looking for work, they haven't been able to find work, etc. And if to make some level of demonstration, depends on the state, but they have to make some level of demonstration as to what they have done to search for work. That requirement has to either be eliminated, which states like Pennsylvania have done, or relaxed. So New Jersey relaxed the requirement for a certain period of time. That's the next thing the state has to do. And finally, from the state standpoint, to get the federal money, they have to agree. They, the state, have to agree that the state will not charge an employer for having employees go on unemployment if the basis for the unemployment relates to the coronavirus. So if the state does those things in terms of relaxing eligibility, not charging employers, then the federal government is going to help the state supplement their unemployment trust funds. And this applies to unemployment claims that were filed between mid-March and the end of this year. Mid-March being March 18th, when this first Family First Coronavirus Response Act was passed. Between then and December 31st. So that's the time period for this particular relief. Then we had the CARES Act. And many of you have heard of the CARES Act because that's where the PPP loans come from that Danielle just mentioned in a question a minute ago. But the CARES Act, in addition to all the small business loans, which are the biggest part of the CARES Act, the CARES Act also expanded unemployment benefits, and in very, very substantial ways. First, under the CARES Act, expanded types of employees are entitled to get unemployment compensation benefits. Importantly, it includes now self-employed individuals and independent contractors. So we hear a lot about, quote, gig workers. Those people are now entitled to apply for unemployment. Now, I'm not telling you that this is going swimmingly at the moment. Pennsylvania took, it was until just a few weeks ago before they were even accepting applications for this expanded unemployment for business owners, self-employed individuals. So I'm not telling you it's going smoothly, but it is there, and it was put into place under the CARES Act. What you may have heard an awful lot about is the second big impact the CARES Act had on unemployment, and that is this extra $600 a week. That is not a typo. It is an extra $600 a week to every employee who is receiving any unemployment benefits. So if they get $1 in state unemployment benefits, they get the extra $600 per week, period. The CARES Act also funded that traditional waiting week that I mentioned a minute ago had to be waived. In the CARES Act, the federal government actually funded that. And the other important thing that the CARES Act did on unemployment is it gives an extra 13 weeks of eligibility beyond what the state gives. So if the state gives 26 weeks of unemployment benefits, if that runs out, then the employee gets another 13 weeks. Or let's say an employee was unemployed for some period of time and they came to you, and now here we are in this unfortunate situation. Maybe they used up all of their state unemployment benefits. They still can get an additional 13 weeks here under the CARES Act. I think it's very important in dealing with unemployment with employees to make it very, very clear that you as the employer do not give unemployment. You do not let them collect unemployment per se. You do not determine what an employee gets or when they get it. It is determined by the state. And even though the federal government has stepped in, it's still the state. So if the state has a terrible unemployment website, it's very difficult to get a PIN. I've had a lot of questions about that in Pennsylvania. It still is being administered by the state. And there's really nothing that the employer can do to speed up the benefits. So I think that's very, very important to understand. If you do have to notify an employee that you're going to lay them off or you're going to reduce their hours, it's important that you put in the notice of layoff or reduced hours that the reason is due to the impact of the coronavirus pandemic on your business operations, because that is required for the employee to get that extra $600 per week benefit that we mentioned. And that is important for you as an employer, because you don't want to get charged. You do not want this to count against your experience rating, so you want to make it clear that this layoff or reduction in hours relates to the coronavirus pandemic. In certain situations, before an employee were to go on unemployment, you as the employer can say, hey, you've got this bank of paid time off. I'd like you to use that first, and then we'll see where we are. And if you run out of that time, then you can go on unemployment. A good example of that may be that you ask an employee to stay home. So somebody asked the question earlier when we were talking about our workplace safety issues about, hey, can I get somebody to identify, or can I ask them if they have high risk factors, things of that nature? Well, let's say you have somebody in your workplace who comes to you and says, just to let you know, I have X condition, I have asthma, I have to be really careful, whatever it is. Then you could say, hey, you know what, we'd really like you to stay home. We don't want to put you at any greater risk. And you can say to them, hey, use your PTO to cover this time. And then if they're still not able to return or you're not comfortable with it, then the employee can go on unemployment. But you can, as the employer, request that the employee uses up their paid time off before they go on unemployment. So for unemployment, you may have employees with reduced hours. We would refer to that typically as them being furloughed. They are probably going to be entitled to partial unemployment benefits. And again, as I said earlier, if they're entitled to even $1 of state benefits on unemployment, they get that extra $600 per week, and that's through the last benefit week of July of 2020. So in Pennsylvania, it's July 24th. That week will be the last week that $600 per week will come into play. Very critical question that I have been asked many, many times in the past few weeks. And that is, what happens when you have an employee who just does not want to come back to work? They're not infected. They're not staying home with someone who has the virus. They're not staying home with a school-aged child. All those things that we've talked about, they don't have any of those, but they just don't want to come back to work. Those employees are not entitled to unemployment. Despite, for those of you in Pennsylvania, many of you may have heard an interview with the governor who said, no, they just can get unemployment or pay them more. That was his statement. That employee who just does not want to come back, but they are not infected, is not entitled to unemployment. And you as the employer should contest a continued unemployment claim by that particular employee. And if you don't, you're going to have employees who are going to line up at least until the end of July with the additional $600 who are going to say, hey, I just don't want to come back. And I'm going to give you some backup for what I'm saying. Here's a chart. You can download it from the web. You'll see at the bottom right. This is on the Pennsylvania unemployment website. I know it's a little difficult to read here, but again, you can download it. You'll get our PowerPoint on the ELDI website. But this chart's very, very critical. This is the Pennsylvania unemployment scenario chart related to COVID-19. If you go down and you look at reason number 5 on this chart of scenarios, they've got various scenarios here. Reason number 5 is a worker chooses to remain home, but they are not infected and the employer is open. And you go across to the third column where it says, do they get unemployment? And there's a big red X. They're not entitled to unemployment. New Jersey, same thing. In New Jersey here, you'll look at line item number 8. And it's the same kind of thing. The employer is permitted to be open, but the worker is just afraid of gathering in a group and they refuse to work. And you go over to the third column again about whether unemployment is available, and there's a big red X through it. So it's important that you as the employer know what your rights are or are not, and that you communicate to the employee that, hey, you're just not going to be entitled to unemployment. And we as an employer, you've got to submit information to unemployment, and you cannot defraud this program. So if you have work available for an employee and they do not meet any of the reasons for leave and they just don't want to come back, that's the same as having abandoned their job, as we used to talk about, prior to this pandemic. So very, very important to keep in mind. Again, not that we want to be confrontational, but this one is out of our hands. You are going to certify that you recalled this employee for work and they chose to remain at home and they don't qualify for leave. So very, very important to understand. Did we have any questions about unemployment?
We do. We have a couple.
Okay.
Has the Department of Labor made a decision about self-insured organizations if they are going to get 60% or higher?
I have not seen that just yet. We will get something, but right now I'm not seeing anything on that. I'll take a look for that, and if I can see any guidance on it of which I'm not aware right now, we'll send out an ELDI alert. Do we have any other unemployment questions?
Yes, we plan to eliminate a position before and unrelated to COVID. Will they qualify for expanded unemployment compensation?
If it's truly not related to COVID and you don't certify it that way, and the notice of layoff that I mentioned a minute ago, then they will not likely get it. Let me say, as a practical matter, they probably will, because I don't know. I can't sit here and say to you that unemployment is going to specifically evaluate the notice of layoff. They're going to look for the check boxes on the unemployment application, and the employees certainly will say it's related to COVID to get that extra $600 a week. It is not chargeable to you, so it would be up to you as to whether you want to push and contest it. Probably you don't, and the employee would get the extra $600.
Okay, two more. What should we do if we receive the unemployment notice after the date to respond?
Okay, that's a great question, because that has been happening through the inefficiencies of unemployment. You should immediately contact unemployment. Now, you may have a very difficult time coming through, but if you want to contest and you don't get your paperwork, including your request for relief from charges, until after the deadline, you need to immediately call, save the envelope, save anything you get, so you can prove the date of receipt, and submit your contest notice. So for example, if it's an employee who you want to contest the unemployment claim because you've offered work, they don't want to come back to work, you want to file the paperwork to contest the claim, and you want to make it very clear and submit a copy, because you know you can attach documents. We do that all the time. Make sure if you have an envelope, if you have an email, whatever you have, make sure you attach that to get yourself an extension of time.
Okay. One more. We are under the reimbursement method for, I believe it's New York State, it's NYS.
Okay.
We are only responsible for are we only responsible for the 26 weeks, or must we also reimburse the additional 13 weeks and additional $600?
That's a great question, but I'm going to defer you to your accountant, because that is one I don't want to steer you wrong with your accountant or your payroll administrator. If you use Paychex, ADP, something like that, they would be able to answer that question for you. I'm sorry, I can't give you the answer off the top of my head, but I do not want to mislead you on that, because that's a very, very important question.
Okay, one more just popped up. If we let people off due to budget cuts from the state due to COVID-19, we don't have to contribute to unemployment in New York State. They're asking a question.
Again, you have to ask your accountant that question. I just don't want to answer specifically for that. That is an accounting question, and so I don't want to misspeak and mislead you. So great question, but I would advise you to talk to your accountant about that. Okay.
I'm sorry, one more question.
Sure.
What if you are being charged for an employee who quit before January 1st, 2020?
Then everything that we have just talked about is not going to apply. Now, in turn, that employee is going to have the work certification requirements that we talked about. So I mentioned that the work search requirements are suspended for unemployment claims right now that are related to coronavirus, but they're not suspended for that employee. And so if that employee is not meeting the work search requirements, I realize it's difficult for you to know about that. I'm assuming it's not an employee that you want to bring back, but I would be at this point thinking about, can we contest? can we say, hey, this employee should be back to work, et cetera, et cetera. I'm surprised that a claim is going on that long right now, because even though we've got millions of people unemployed, there are plenty of employers who are hiring. So without knowing who the employee is or what they were doing, I can't comment further, but I will say that you will be charged for employees who were released into unemployment by you prior to the coronavirus outbreak. So you want to follow up a little bit differently for that particular employee, because you would still be charged even if the unemployment runs into this coronavirus period. Okay. So work from home policies. This is another hot topic. So everything shuts down in March, middle of March, and we send everybody to work from home. Now, some of you I know work with me, and we talked about work from home policies before all of this started. And so some of you have issued statements that because of this coronavirus outbreak, we're going to temporarily allow work from home, but it's not a permanent change to our policy. So some of you have probably done that. Many of you probably have not, because the shutting down of the business was such an absolute fire drill that you just didn't have time to do anything. So we have to talk about, how are we going to handle work from home now? Do we suspend that policy, or do we continue that policy? Part of the answer might be dictated to us by the state. So Pennsylvania, for example, has this system of opening that's, red, yellow, and green. And yellow, once some things are allowed to open, still requires employees to work from home if they can do that. So to some extent, the state may tell you whether or not you're allowed to suspend work from home. But leaving that aside for just a minute, as part of social distancing practices, and we talked about that in workplace safety, you may want to continue work from home for some limited period of time for employees who can do so and can do so effectively. Is understand the ramification of continuing a work from home policy outside of this pandemic. Because the longer you keep a work from home policy in play, the longer it is going to be deemed, or the greater chance you have of work from home being deemed a reasonable accommodation for any employee who has a disability after this pandemic is over. So I'll give you an example. Let's say you have an employee who has migraines, and they get them whatever number of times per month. Maybe you've gotten a certification from a doctor that they need to be able to come in late, alter their hours, et cetera, when they have a migraine. Similar situation, someone has a soft tissue back injury, they have bad back. And some days it's just really, really difficult for them. And now they come to you and they say, you know what? We were working from home during that coronavirus outbreak, so can I just continue to do that? It'll be a lot better for me with my migraines, or I have a chair at home that's really comfortable. Why can't I do that? And if you have continued to allow work from home, even after this pandemic, you are going to be very hard pressed to say to that employee, no, I want you here. So you have to make a business decision as to whether working from home is working for you. And it may be, or it may not be. When the closures were required by the state, you had very little choice. And so in terms of saying, hey, I did it then with coronavirus, so let me work from home now, you may be able to say, gosh, I really only did this because, the business had to shut down. We couldn't reopen. So now that you're allowed to reopen, you may want to just say, we ended our policy, or you may only want to extend it for a very limited period of time so that you can take some time to think about whether you want to do this in the future at all or on a limited basis. So if you do not want to continue working from home as a policy, but you allowed work from home while your business was closed, et cetera, again, just watch, because employees who say they're disabled may be entitled to work from home as a reasonable accommodation if we don't stop it. Now, very important to remember, work from home is not a reasonable accommodation simply because an employee asks for it. Work from home is only a reasonable accommodation if the employee can still perform the essential functions of their job. So if they can't do that, then they're not entitled to work from home as an accommodation. Very obvious example is they work on a piece of equipment at your office. Well, they can't do that from home, so that's not a reasonable accommodation. If an employee is required to meet with customers, if an employee is a receptionist and they're required to greet people who are coming in, those are not functions that can be done from home. So even if they say, well, gosh, you allowed work from home for all these other people with coronavirus, why can't I? It's because they can't perform the essential functions of their job. But the longer you allow somebody to work from home during coronavirus, and as the reopening process starts, the closer you're going to be to being required to allow it as your business reopens and we work our way through this pandemic. It also brings up again the importance of job descriptions. Now, those of you who come regularly to our ELDI seminars know that there pretty much is not one seminar that we do not make it through where I talk about how important job descriptions are. And they are, because in a job description, what do we talk about? The essential functions of our job. So take this time as you are deciding whether you're going to continue work from home to really look at your job description. And we talk about making sure you have all the physical functions of your job in your job description, but also think about whether or not this job is truly attached to the workplace as opposed to work from home. And think about that as you're reviewing your job descriptions as well. Once you sit down and you think this through, make your decision about whether you're allowing work from home and announce it. Take a position and make it clear to everyone what the answer is going to be. If you decide that you are ending work from home, communicate it. And as you heard me say previously, it's all in the presentation of how you communicate that you're ending work from home. So for example, you could say, we appreciate everyone's teamwork during the outbreak. It was vital to continuing the operations of our business, and we are truly, truly grateful. But now that we're allowed to reopen, we are ending the work from home that we used during the pandemic, and we are back to our normal attendance policies. That's something like that. Appreciating the teamwork, but making it clear that we're ending work from home would be a way to go about doing it. And communicate it through email. If people are working from home, put out a policy announcement. I will often say, if you want to make sure that somebody is aware of a new policy, print it and put it in their payroll envelope. And that's a way to make sure that everybody has received the announcement. Make sure that you can articulate the basis of your decision. So let's say you decide that some positions are going to be able to work from home for some period of time, but everybody else has to come back. Make sure that you can articulate why that is. So for example, let's say you're a manufacturer. Obviously, everybody who's on the production line has to come in, that's what they do. But you're going to have the office personnel who are in administrative positions, you're going to have them work from home 1 day, 2 days a week. And the basis is that they don't have to work on specific pieces of equipment or a production line. And you are having them work from home a couple of days a week to promote social distancing. That makes sense. You have to think about how the administration of your work from home policy would look to a third party. This is the guessing game that we talk about all the time when we talk about other types of discrimination claims. Would somebody else looking at this, an EEOC investigator, for example, would that person say, hey, wait a minute, you only allowed X type of employees to work from home, and you made all of this type of employee come back, and you can fill in the blank. You know, you made all the minority employees report, but not the Caucasian male employees, something of that nature. I know that's not how you're thinking about it right now. Keep it in the back of your mind, because what you don't want is to get some type of claim after you're back up and running and you think you're through all of this. So as you're thinking about what you're going to do with work from home, think about just how it would look to a third party. Some other considerations to think about when you're figuring whether you're going to continue a work from home policy is, do you need to stop work from home to control your confidential or proprietary information? Easiest example, your controllers, your bookkeepers, your finance people. Maybe you allowed them to take some information home or email it to a home account so that they could continue to work on financial reports and things of that nature, do invoicing, things of that nature while the office itself was closed. But maybe you just don't want that and you want to protect your information, so you're going to end your work from home. Same type of thing is employee productivity. That is just a legitimate basis to decide, I don't want work from home. It is very, very difficult for employees to be as productive at home as they are in an office or at a job site when all they're focusing on is work. So it is absolutely legitimate for you as an employer to say, you know what, I'm going to do all of these other things to keep my employees safe, but I need everybody back to work so that we can ramp up production. Completely legitimate, and it's an okay basis to give for ending work from home. For the employees who, may have other reasons for leave, you might want to let them work from home. So we talked quite a bit about emergency FMLA, the paid sick leave. Those employees, you may say, okay, we're going to use intermittent leave because we need you to do some work, but we understand you're otherwise entitled to leave. You could allow that to happen. You could also say that you will only allow work from home as part of a response to a pandemic. So we're suspending work from home for now. And if, God forbid, we find ourselves in another situation like this, we may reinstate it. Or maybe as part of a long-term plan, maybe somewhere in the future you'll return to work from home as technology develops and security is more readily available for what you do, those types of things. But until that time, we're maybe not going to allow work from home to be used. Do we have any questions about work from home policies?
We do have one. If we state that telecommuting is only available during the pandemic and give it to a specific time frame, will we still run into a problem of not being able to end it later?
No, I think if you say, look, we're back up and running, but we're going to continue work from home until, say, September 1st, because we're going to use work from home a bit to promote social distancing, things of that nature, but it will end September 1st or whatever, that's okay. Because you're setting some parameters and then you're ending it. And I think that's absolutely a fine thing to do, because there's no argument about it right now. And you're saying at the end that, okay, if somebody comes to you in, say, November, they're having surgery or something and they want to work from home, and they say, well, gosh, we did it during the coronavirus, why isn't it okay now? You will still be able to say, even though you extended that, you will still be able to say, we had to make special changes because of the pandemic, because such a huge part of our workforce was shut down, not able to come to work, whatever it is. But now that we're back to normal, quote unquote, we really can't allow it because it really wasn't in the best interest of the company. That is okay, but set parameters. I think that's perfectly fine to do. So layoff and recall. We're going to be dealing a lot with that, for better or for worse, for, unfortunately, I think some bit of time now. And I ask the same question that I asked with regard to work from home policies. And that is, when you're deciding who you're going to lay off and who you're going to return to work, before you make those decisions, just stop for a minute, just 1 minute, and think to yourself, how is this going to look? Am I only laying off all of my quote unquote older employees? Am I laying off only minority employees? Am I laying off only this type of employee? How does it look? How am I picking these people? So think about that as you're making a layoff decision. When you're recalling people, the same question applies. Am I only recalling this group and I'm leaving the rest laid off? Why am I keeping just that one group in layoff status? That's a very, very important question to ask yourself. you should be able to articulate what we call a legitimate, non-discriminatory business reason for how you made the decision to lay off less than everybody, or to lay off less than everyone in a particular department, or things like that. So here are some things that you can absolutely look at in making a layoff determination. You could say, I'm laying off everybody on a particular shift. You could say, I'm laying off everybody on third shift because we're going to use that time to clean everything. We're going to do a heavy duty cleaning of all the equipment, the common areas, locker rooms, whatever it happens to be. And in order to do that, we've got to shut down third shift for right now. Completely legitimate. You could say, I'm going to lay off all my part-time people. Okay. That has nothing to do with any individual characteristic. It's just they are part-time. You could lay off by tenure. That's perfectly okay as well. You're going to hear a lot as we move through the next months about cross-training. And that means the concept of having people trained to do multiple jobs or having multiple skill sets, so that if we're bringing back fewer than all people, or if people are going to continue to be out because the virus won't be over once we're reopening, people who can work in multiple departments or can work on multiple pieces of equipment or can do multiple jobs are more likely to be selected for recall. And that's perfectly legitimate. If you say, and many of you have already said this to me, well, Kim, you know what? I only want the best people back. I don't want the person who was a pain in the neck to begin with. I don't want the person who was lazy. I don't want the person who was always underperforming. I want to bring back my best employees. Completely makes sense, right? But do you have documentation of that? Because if you don't, we really want to think about it. Not to say it's going to change our mind, but gear up for the battle. That employee, that same employee that we're talking about that's kind of lazy, they may be okay on unemployment. You're never going to hear from them again, or at least not until the end of July passes when they stop getting their 600 extra a week. But we have to think about that. So if you say, you know what, I'm just not bringing this person back, or I'm going to lay them off because they weren't really a great worker to begin with, and that's your basis, but you kept everybody else in their department, etc. Just think about what we have that would prove that if we were ever questioned about it, okay? So same kind of thing. If we're gonna recall employees, but we're not gonna recall everybody, it's the same kind of analysis. Do we have and can we articulate a legitimate, non-discriminatory business reason for only picking this group versus that group to bring back? You may decide, I'm only going to return my essential employees. I need employees to come in, restock, get everything set back up, clean everything, and prepare for reopening. And I'm not going to bring back yet my customer-facing employees. Okay, that's a very valid business reason to make that choice. You could return people on the basis of their tenure in departments. The longer tenured employees are going to get to come back first. I mentioned cross-training a minute ago. Maybe you're going to bring back first the people who could work in multiple departments or could work at multiple jobs. That makes sense from a business standpoint. You may say, I'm only going to bring back my full-time people. I'm going to bring them back, and then we're going to see how business picks up, and then I'll recall my part-time people. Or since I'm only allowed to work limited hours, maybe I can't have the part-time people right now. I'm just going to give those hours to my full-time people. That is very legitimate business reason to make that decision. Same kind of thing that we just talked about for layoff. If you're not going to recall somebody because they weren't a great worker in the past, do you have documentation for that? Is there a reason that you don't want that employee back that we can say, I have these emails. Look at all these emails. I had all of these problems with this person. I don't need that person back. And that is a legitimate, non-discriminatory business reason for not bringing somebody back, but we have to be able to show something. So just think about that when you're in the recall process. The other thing that I think is important to do is when you're recalling people is say, hey, I need a response from you by such and such a time. Hope to see you back to work. Happy to have you back, but I do need to hear from you by a certain date. And then if somebody doesn't report back to work or tell you that they're coming back, then you separate them from the company and you notify unemployment accordingly, because there will be other people who will want to fill those jobs. So I think it's very, very reasonable to articulate that and ask them to let you know. Do we have any questions about layoff or recall?
No.
Okay, so let's talk quickly about some best practices. The most important thing that you can do is communicate. Very, very simple. Tell your employees about what your new policies are. If you have the new hygiene practices we talked about, if you're requiring the use of personal protective equipment, if you're going to require employees to stay home if they're ill, if you're going to start temperature screening, anything like that, notify your employees. Don't wait until they come back to work to tell them. Communicate with them. If there are going to be new workplace procedures, such as you're altering work schedules, you're altering lunch breaks, you're altering traffic patterns within your store, your office, etc., communicate that. Make sure that everybody understands sick and call out procedures. When all of this started, we talked about relaxing sick policies and how there could be disciplinary consequences to that. You're all probably reopening in the midst of this pandemic still, and we still don't want employees coming to work sick. You might need to leave those relaxed policies in place for now. But maybe in October, you don't want to do that anymore. You're just going to have to communicate that. You need to communicate about the available leaves that we talked about. Reminder about that federal poster that we talked about the federal leaves. Make sure you have that up. If you're going to end or continue a work from home policy, communicate that to your employees. If you have a recall policy that you're going to put into place and you have set out the criteria for recalling employees, that's okay to communicate as well. Because what's going to happen is employees are going to talk to each other, and if somebody's getting recalled and somebody else isn't, that starts the employee rumor mill, and that can create a problem. So communicate it. If you're only bringing back first and second shift, but not third shift, make it known. If you are only calling back, certain types of essential workers to get the business set up again, make it known. That's completely fair, and it stops the employee rumor mill from going on. If you are reducing hours, you're going to want to talk to employees about how they're going to communicate or how they're going to record those hours, things of that nature. How are you going to communicate all this to your employees? You want to email them before they return to work, if that's possible. Mail them a letter if they don't have an email address, if there's no personal email address on file. Footnote here, when you hire employees or as you're working through this pandemic, it is a good practice to require or ask for a personal email address. So that would be important here, for example. You could also do a conference call so that before people return to work, they know what's going to be new in the workplace, how we're going to operate, things like that. Check to see if there is a state mandated poster for you when you reopen your business. Pennsylvania has put out a poster for reopening procedures and guidelines for businesses that are reopening under the COVID guidelines in Pennsylvania. We will have that poster up by tomorrow on the ELDI website. That will be again at eldi.legal, and it will be on the employer's toolkit page that you heard me mention a couple of times today. This is a poster that Pennsylvania employers will need to have up in the workplace, and it needs to designate a COVID-19 resource officer. And it needs to be signed by a representative of the employer certifying that they agree to follow all of these guidelines. There is no such poster yet for New Jersey or New York. We'll keep our eye out for it. If there is one that is published, we will send you an ELDI alert. But for right now, it is Pennsylvania. Get the poster, put it up, okay? Because that is something that is going to be required for you to reopen in Pennsylvania. Another thing to think about is to have employees sign off on some of these new policies, particularly a hygiene policy. If it's going to be something like you're going to have to do periodic breaks or have periodic breaks for hand washing, you're going to agree that you're not going to come to work ill, things of that nature, you may want to consider having a policy, putting it in writing, and having employees sign off that they are going to agree to live by it. And in addition to making sure that you have evidence that everybody knows, I think it's important too to make employees understand that you are taking this seriously, and that makes them more comfortable about coming back to work. So with that, do we have any other questions at this point?
Yes, we have one. Will this poster need to be posted if we have been considered on essential business and have never closed?
Yes. So it does not read that way when you look at the poster itself. It really doesn't make that distinction. But yes, so in Pennsylvania, what's happening is that everything is classified red, yellow, and green. So even for those companies that have remained open while the entire state's been on lockdown and everybody's been in that red category, once everybody moves to yellow, there are still some things that are loosening. Not going to be easy to ascertain, I assure you. But to get into that yellow phase, or once we move into that yellow phase, you will have to have this poster up. So use it even if you've been open throughout the entire pandemic. It is certainly a best practice. Pick your coronavirus resource officer and just have somebody sign that you're going to be following these practices. It's just for your protection. You should definitely use it, and everybody will be required to have it as they reopen. So you definitely should use it even if you've been open.
Okay.
Everyone, thank you so much.
One more question.
Oops, okay.
Sorry.
Somebody popped up. That's okay, great.
What do we do about employees who refuse to sign off on new policies?
So you can put, much like we talk about written warnings, you can put employee refused to sign, and whomever the HR person is or supervisor is, sign and date it themselves. Because the importance of it is that we communicated it to the employee and set it as an expectation for employees to follow. It is by far the better case if an employee will sign it and all that type of thing. But if they won't, ask them why. Like, why are they not going to sign it? They may just have reasons that they've had enough of being told what they have to do and the new normal, and they may be tired of hearing all that. And so they're just a little put off by it, but they understand that they have to do it. Maybe you can talk them through it and you'll get them to sign it in the end. If they flat out refuse to sign, then you say to them, look, these are the expectations. And if you don't follow them, you're not going to be able to stay. And we don't want to be in that position. So we'd like you to sign it, but either way, you're aware of the policy and you are going to have to follow it. And then you, the supervisor or the HR person or whomever, sign it and date it, put it in the employee's file. And that's what we talk about with regard to workplace warnings. Sometimes employees don't want to sign a warning, a written warning, and people will call me and they're upset by that. But my response to that is, you told the employee, you gave them the warning, and if they sign it, great, fantastic. But if they don't, you, the supervisor, indicate that you gave it to them, they refuse to sign it, and sign it and date it, and that's good enough. And I would give the same advice here. So thank you all for spending your time here. I know that everyone is getting millions and millions of invitations. I know we spent a lot of time here today. I hope it was helpful to you. Please feel free to go on the ELDI website to download any of those forms that I talked about earlier today. And you can see on the screen my telephone number and email. Please feel free to email me, and hopefully we can all move through and be back up to work. Thanks so much, everyone.
Thank you.
Thank you, Kim.
Thanks.
Thanks, Kim.